There are moments in veterinary medicine I still think about decades later. Mowgli is one of them. He was about 4 years old when the owner brought him to me, and she was a bit worried, but she was not worried about his mouth. She did not know yet that his mouth was the biggest problem. She thought something was wrong with his personality. He had started darting through the house like something had shocked him. He was urinating outside the litter box, and he would paw at his face. He wasn't eating that well either, and he seemed uncomfortable, but in a way that was hard for her to name. And she was embarrassed. She wondered if she had done something wrong, and if he was stressed, if she had somehow failed him. I want to pause here because this matters. And if you have been searching for why your cat has severe red gums, an inflamed mouth, or trouble eating, bad breath, drooling, or pawing at the face, or a sudden behavior change, this may be the video you were looking for. Not because every cat with those signs has the same disease, but because those signs can mean pain. And in cats, pain often does not look the way people expect it to look. That was true for Mowgli. When I examined his mouth, what I found was severe feline chronic gingivostomatitis. That's a pretty long name, so let me break it down simply. This is not just bad teeth. This is not just mild gingivitis. This is not something that can always be fixed with dental cleaning or different food. Feline chronic gingivostomatitis is a painful chronic inflammatory disease of the mouth. The gums can become intensely red and inflamed. The tissues at the back of the mouth can be swollen and raw. And in some cats, the immune system reacts in an exaggerated way to the plaque and the oral bacteria or viruses or other triggers in the mouth. And the result is severe pain, real pain, the kind of pain that changes how a cat moves through his world. Everything Mowgli's owner described as behavioral was pain. The bolting through the house, the litter box avoidance, the face pawing, the reluctance to eat, all of it. And this is one of the hardest things to communicate to cat owners. Cats do not show pain the way we expect pain to look. They usually do not cry out. They often do not make obvious signs that they're in pain. Instead, they adapt, they compensate, they change their routines, they avoid things that hurt. And those changes are very easy to misread as anxiety, aging, stubbornness, or just a bad attitude. A dog with mouth pain may be more obvious. They may drop food or chew on one side or drool or resist having their face touched. Cats can do some of those things too, but many cats are quieter about it. They may still walk to the food bowl, sniff the food, and then maybe walk away. They may eat less, but not stop completely, or they may hide more. They may become irritable, or they might stop grooming. They may miss the litter box because pain has made their whole body feel unsafe. By the time a cat is visibly uncomfortable at the food bowl, that cat has often been uncomfortable for a very long time. Sat down with Mowgli's owner and I explained that what we were dealing with. And then I explained the treatment option. And that sounded, understandably, extreme. At that time, our best option was a full dental extraction. Removing all of the cat's teeth is a very hard thing for an owner to hear. Sounds drastic and it sounds like a last resort. Honestly, it is. Sounds like something that must make the cat's life worse. But in many cats with severe feline chronic gingivostomatitis, removing the teeth removes the primary surface where the plaque and the oral bacteria keep triggering the immune response. And for many cats, that can bring dramatic, lasting relief. I watched her face when I explained it. She had questions. She needed time to process it. That is completely normal. Did not blame her then, and I would not blame any owner now for needing a minute to absorb that recommendation. Because when you love your cat, the idea of removing all their teeth feels enormous. Here's what I wish more people understood. Cats can actually eat without teeth. They do not chew the way people chew. They tear and grip and swallow far more than we imagine. Many cats who have had full mouth extractions go on to eat canned food or softened food, and sometimes even dry food, depending on the cat and the situation. The goal is not to make the mouth look normal. The goal is to make the mouth stop hurting. And that is what happened for Mowgli. He did well, he recovered, and he learned to eat without teeth in a way that cats often do, which is to say, completely fine. More importantly, he became comfortable. The strange, fearful bolting stopped. He started using the litter box normally again. He ate with interest, and his owner told me he became himself again. And at his recheck, she cried. Not sad tears, the other kind. The kind that come when you realize your animal's no longer suffering. And now they're doing just fine. I have thought about Mowgli many times over the years, but I have thought about him especially recently because something has changed in how we can approach this disease. There are newer medical options for selected cats with feline chronic gingivostomatitis. One example is something called Gingipro, a compounded prescription medication intended for certain cases, especially where feline calicivirus may be part of the underlying picture. It combines antiviral, anti inflammatory, and antimicrobial support in one formulation. This is important, but I want to be very clear. This is not a cure. It is not appropriate for every cat with red gum line. It is not something to use because a photo on the internet looks similar. It requires proper diagnoses and veterinary oversight. But it matters because for many years, extraction was the main tool we had for severe cases. And extraction can work beautifully. Mowgli is proof of that. But extraction is not always the right first step for every cat. Some cats are poor anesthetic candidates, and some cats continue to have inflammation even after full mouth extractions. Some owners need time to understand the diagnosis before committing to surgery. Some cats may benefit from medical management at first step or as part of a broader treatment plan. If medication existed like this, Mowgli I may have considered it. That does not mean I regret his extractions. I don't. They gave him comfort and they gave him his life back. They gave his owner the relief of seeing him become himself again. But in medicine, more tools means more options. And more options mean we can meet each patient where they are at. This is where I want to speak directly to cat owners. Do not try to diagnose feline stomatitis from photos. Do not assume that red gums always mean the same thing. Do not assume that bad breath is normal. And do not assume that a cat who is still eating can't be in pain. Many things can cause oral pain, redness, drooling, bad breath, and a behavior change in cats. Dental disease can do it. Tooth resorption can do it. Viral infections can be involved. Kidney disease can change the mouth. There's also oral masses which can cause pain, or foreign material, ulcers, trauma, and other diseases can overlap in how they look from the outside. You cannot sort through all those things at home. What you can do is notice. That is what Mowgli's owner did. She did not know his mouth was the problem, but she knew something had changed. She noticed the darting, she noticed the litter box accidents, and she noticed the pawing at the face. She noticed he was not eating normally. And noticing is not failure. Noticing is beginning. That's the beginning of actually helping your cat. So write down what you're seeing. When did it start? Is your cat eating less? Are they dropping food, walking away from the bowl, or pawing at the mouth, or are they drooling a little bit? Maybe they're hiding or acting kind of irritable. Or are they urinating out of the box? That's a common one for dental disease. And sometimes they're actually grooming less. Sometimes that breath can really smell bad too. Those details really help your veterinarian. And then your cat needs an exam, a real mouth exam. Sometimes that exam is limited when a cat is painful, and sometimes sedation or anesthesia is needed to fully assess what's going on. That is not because anyone is trying to be aggressive. It's because painful mouths cannot always be safely or thoroughly evaluated in an awake cat. If the diagnosis is feline chronic gingivostomatitis, know this: there are more paths forward than there were before. Bone mouth extraction remains a strong and well supported option for many cats. Medical management, including newer therapies in selected cases, may also have a role. Some cats may need both. Some cats respond better than others. The plan has to fit the cat and the severity of the disease, the underlying causes, and the owner's situation, and the veterinarian's assessment. But the goal is the same either way: get that cat out of pain, help the owner stop wondering what they did wrong, give the cat its life back. That is what happened for Mowgli. And that is why I still think about him, because his story reminds me that pain in cats often wear a very interesting disguise. And sometimes it looks like fear or behavior or even a litter box problem. And sometimes when we finally look into the mouth, the story changes completely. So if your cat has severe red gums or inflamed mouth or trouble eating or pawing at the face or drooling or bad breath, or behavior feels suddenly different, please don't wait too long. It may be stomatitis, but it may be pain, and pain deserves to be found. If this was helpful, subscribe here on YouTube. And if you want a written version of Mowgli's story, you can read the full essay on my Substacks Lessons Across Species series. And if you have a pet story which is similar, drop it below. I would love to hear from you.